Hello, I'm Debbie Robson. We've put this training video together to support the provision of e-cigarettes and other safer nicotine products to the people in the London temporary hotels.
80% of people living in your temporary hotels will be smokers. They're likely to be heavy smokers and physically and psychologically dependent on their cigarettes. And their high levels of dependence mean they want to smoke most of the time, and they'll seek out opportunities to smoke, particularly when alternative forms of nicotine are not available. Early research is showing that smokers who contract COVID-19 have more severe symptoms, so they're more likely to be admitted to ICU or need ventilation, or sadly die compared with non-smokers. So as the risk of contracting COVID-19 needs to be minimised amongst people in your hotels, tobacco harm reduction should be prioritised, along with all the other high-risk behaviours residents are exposed to. Smoking behaviours that increase the risk of COVID-19 transmission include behaviours that you'll be well familiar with. So sharing the same cigarette with friends and strangers, picking up other people's discarded cigarettes and smoking them, or collecting up lots of dog ends and remaking a new cigarette from discarded cigarettes, or lighting a cigarette with someone else's cigarette. So why offer this group nicotine replacement? For lots of reasons. So to prevent nicotine withdrawal symptoms for someone who's confined to a bedroom, minimising the risky smoking behaviours that we've just highlighted, reducing the risk of fires from smoking in bedrooms, or to prevent people who used to smoke going back to smoking in this really stressful time. And for some residents, a temporary stay in a hotel during these unusual times will be a trigger for making different choices about one's health, including reducing harm from alcohol, illicit drugs, and tobacco. Nicotine is really addictive when it's delivered in tobacco smoke, but it's not what causes the harm from smoking. That comes from the 7,000 toxins, so your tar and your carbon monoxide in tobacco smoke, and not the nicotine. Nicotine doesn't stay in the body for very long, so withdrawal symptoms start as soon as you finish your last cigarette, so within 30 minutes to 2 hours. And symptoms include irritability and aggression, restlessness, poor concentration, depressed mood, you get some sleep disturbance, and then people might start to cough or get a sore throat. But all these can be minimised by replacing the nicotine a smoker usually gets from their cigarette with an alternative and cleaner form of nicotine. Your Vype starter kit comes with your Vype device, 2 pods and your charging lead. Take a pod out, place it in the device, click down firmly and it's ready to go. To turn it on, 3 quick clicks, 1, 2, 3, and that green button shows you it's charged and ready to go. To use the Vype, you press down on the button and you inhale at the same time. And you can see it doesn't produce clouds of vapour like some e-cigarettes do. Vaping's not like smoking in so many ways. With a cigarette, what you do is you smoke the cigarette all in one go and you effectively binge on the cigarette. With vaping, what you're doing is grazing throughout the day. So you're taking small puffs and you're spacing out the time between your puffs. Each smoker extracts around 2 to 3 milligrams of nicotine from each cigarette. So a 20-a-day smoker, you're going to get about 20 to 40 milligrams of nicotine. There's 18 milligrams per mil in a Vype pod, and there's 2 mils in every pod. So it's essentially nearly 40 milligrams of nicotine. So a 20-day smoker should be quite satisfied with an 18 milligram pod a day. When the battery gets low, and you'll know because the red light comes on, So it goes from green to red. Put the charging device, insert it at the bottom and plug that into a USB port. When the pod gets low and you've drained it, take it apart and replace it with a brand new pod. JUUL starter kit comes with the JUUL and 4 pods. Take the device out. This is a nicotine pod. And that's ready to go. With the JUUL, there's no buttons to press. It's just a case of starting to vape. And you can see there's not a lot of vapour to trigger off fire alarms. These little pods, there's 80 milligrams of nicotine in them. So a 20 a day smoker should be satisfied with one 18 milligram pod. Charging's really easy. Just take the charging device out of the starter kit and put the JUUL into the USB docking device, and then that gets inserted into a USB port. It takes about an hour to charge the JUUL. When the pod gets empty, disconnect the pod and throw away the pod and just replace it with a new one. We've also given you some nicotine mouth pouches, 2 different strengths of a product called ZYN. So the citrus ones, which is 3 milligrams per pouch, or the mint ones, which is 6 milligrams a pouch. And you'll also probably get some lift or velo. So what you do with these is you take a pouch out of the tin and it gets placed under your lip. So apart from looking very attractive, you have this tingling hot sensation as the nicotine's released. And the nicotine's got to be absorbed through your mouth. And the pouch can stay there from anything from 5 minutes up to an hour. And then when you're finished, you just take it out, throw it away in the top compartment or throw it in the bin. There's enough pouches in here, there's 20 pouches, and that should be enough for somebody who smokes 20 cigarettes a day.
You get very few side effects from e-cigarettes, so you might get a dry mouth and a cough for a few days due to the propylene glycol in e-liquid, but these soon disappear. For the mouth pouches, like other oral NRT products such as lozenges and gum, you might get a sore mouth and hiccups. You know you've had too much nicotine when you start to feel sick. These next few slides just give you a bit more information about e-cigarettes because there's a lot of misperceptions out there. In the UK and the rest of the world, e-cigarettes are not currently licensed as medicines, so you can't prescribe one like you can with a nicotine patch or lozenges. In this country, they're regulated by the Medicines and Healthcare Products Regulatory Agency, so certain ingredients are banned, there's a cap on nicotine strength, and you can't buy an e-cigarette if you're under 18. They're not part of smoking bans here, so you can vape indoors. It's up to the discretion of the business owner. So in our local mental health trust, we've allowed vaping indoors since 2012. And at the moment, there doesn't appear to be any risks from passive vaping, like there is with passive smoking. In this country, since 2013, they've been the most popular quitting aid for smokers and have helped hundreds of thousands of smokers quit. And they're more effective than nicotine replacement therapy. Some work that we've done at King's show that they help people with mental health and substance use problems reduce their tobacco use or quit smoking completely. And in a study we were involved with, led by colleagues at London South Bank University, demonstrated that people who access homeless charities, so in this case it was St Mungo's and the Salvation Army, showed that e-cigarettes can reduce tobacco use in this group. Switching to vaping, compared with smoking, is substantially less harmful than continuing to smoke. And that's because e-cigarettes don't contain tobacco and they're not burned. Completely switching from smoking to vaping improves your lung health and your heart health. And last year, you probably heard that in the USA, vaping illegal THC products was linked to getting a severe lung injury. This wasn't linked to nicotine vaping, but there was a lot of misreporting in the media. And unlike with smoking, there's absolutely no evidence that vaping is linked with COVID-19. So similar to advice about not sharing your cigarettes, advise people not to share their vaping devices. So to summarise, residents in temporary hotels have access to a choice of e-cigarettes, nicotine mouth patches, but also very soon licensed nicotine replacement products. And substituting cigarettes with alternative safer nicotine products will help minimise so many things. So nicotine withdrawal symptoms if you're confined to a bedroom, risky smoking behaviours, it'll reduce the risk of fires from smoking in bedrooms, and it'll help prevent former smokers relapsing back to smoking. It's going to contribute to your efforts to keeping the most vulnerable safe during this outbreak, and who knows, it might be a springboard for future health behaviour changes, because these crazy days are not going to last forever.